Welcome to the Healthline, Issues That Shape Our Well-Being. I'm your host, Dr. Andrea Alt-Brutus. In the Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving complex healthcare system. Today, I'm very excited to have Thurston O'Neill at the Healthline. Thurston is the owner and principal of Thurston O'Neill and Associates, LLC, which provides therapeutic services to youth, parents, couples, and families. He is also the CEO of Long Island Teamworks, his nonprofit, which we'll talk about in a few minutes. So Thurston is a licensed marriage and family therapist with a lifetime of experience in underserved communities and insight on the issues that affect them. Thurston holds a Bachelor of Science degree in Business Management and a Master's degree in Marriage and Family Therapy. He employs an integrative approach, blending elements of different therapeutic models and tailoring treatment according to the needs of each client, couple, and family. He is using all of these approaches for his initiative called the Brothers Like Us Men's Wellness Initiative. So welcome to the Healthline, Thurston. So happy to have you here.
Thank you, Andrea. Thank you very much.
Just to learn more about you, how did you get into the field of mental health?
Okay, so first, let me again thank you so much for having me. I truly appreciate the opportunity to share and your interest in some of the initiatives that we're doing here around the community. My journey into the mental health field, it involves a lot of different elements, right? As I look back, my environment growing up, losing my father at 11 years old, going through bad relationships, and really not really knowing how to navigate it as a young man. That is a major part of what caused me to go down this field because in essence, I was looking to help people that may have been in my very similar situation, not being able to find someone, and in reality, not even knowing that I needed to look for someone for help, to provide that to young people growing up. That's one of the major things that drove me into this field. And then seeing different relationships inside my family and outside my family in the community, some of the things that have gone wrong, but also some of the things that were done right. That, I look to my brother who, I don't know the exact number, but I believe it's like 40-something years of marriage. And I'm like, wow,
amazing.
Right? Not that he was perfect, not that his wife was perfect, but they're still together. And he's now enjoying a life where he's around his children, his grandchildren, and his great-grandchildren, just enjoying life. So, not only the bad things that drove me to it, but some of the good things as well.
Great. So I'm not sure, and I think actually we just talked about this. My research initially was focused on mental health inequities, disparities, looking at how people access care, the quality of care people receive. And there's lots of inequities in the Black and Brown community, especially when it comes to mental health. Can you talk more about those inequities?
I think what people automatically go to is the stigma around it. Of course, we're going to talk about that when we talk about the Brothers Like Us Men's Wellness Initiative. But when you think about our representation in the field, right? The research shows that less than 4% of therapists around the world are people of color, African Americans, right? And then when you talk about the disparity of that is including men and women. So then when you break that down to men, the number drops even further, right? So when someone in our community, in a Black or Brown community, is looking for a therapist, it's not that easy to find someone that looks like you, that can understand the intricacies of our language and our body language, the way we talk, the way we interact with one another. And so we are forced to see people that may not fully understand, and maybe they're learning us as we're talking to them, right? And that is not to disparage anyone that services our people, but the reality is this. When a client walks into my office and sees someone that looks like them, sounds like them, is familiar with the community that they come from, it basically gives them a chance to breathe, to relax. You know, you find many times a lot of us are walking around like we're holding our breath, right? That moment that we get to release and relax and be able to share and not have to explain your dialect to someone. And again, not a bad thing. If it's a good therapist, they will feel comfortable asking you, what does that mean or how does that manifest, right? But to not have to explain that is another level of comfort that our people get when they walk into a room with someone that looks and sounds like them.
And what other factors do you think contributes to these inequities that we see? So one is, you mentioned representation within the provider sector. Any other factors you think are contributing to those inequities?
100%. So much of it is systemic. As we know, many of the disparities that we face are systemic disparities. And so it can link back to what are the reasons why a person of color may find themselves in therapy, right? Maybe they got in trouble and had to go to court and the court mandated them to go to therapy, right? So there's automatically a negative stigma that's attached to it. Maybe you only go to therapy when your marriage is absolutely on the rocks and about to end, right? So your wife or your husband says, listen, we're going to go to therapy or this is over. Again, a negative stigma that's attached to it. Again, it's a systemic thing because it has to do with availability, income, the type of insurance that you have. If you have good insurance, you are able to see a better therapist. Some therapists don't even take insurance. So I would say some therapists that are well established and really know what they're doing, they don't take insurance. So if you don't make a whole lot of money and you're able to afford someone, these therapists can charge upwards of $300-$400 per session, right? And so someone that doesn't have that type of income, they're locked out of what I would say sometimes is some of the best therapy, right? Those are some of the different inequities that we face when we talk about, mental health and therapy for
and what about
people of color.
Also taking time out just to take care of your mental health? Do you find that to be a major issue as well?
Yeah, because if your focus is working to bring in money, and everybody has to do that. I get that, right? But if you don't make enough to where you can work a regular 9 to 5, and maybe you have to do 2 jobs, right? And maybe at home you have to count on someone else to really help manage your home. Where do you find the time to insert an hour, a 45-minute therapy session, right? Now, with COVID, I think one of the benefits was people started to understand that virtual therapy helps with accessibility and more people can navigate getting to therapy. When you had to pack up your children, jump in the car, go to a therapist's office, which I truly believe does add some benefits to in-person therapy, right? But some people just can't do it. And so if it's something that prohibits you from getting there, it's very easy to put it aside and never even think about it again. You're focusing on everyday life. How do I manage these children and this marriage? And, we're not talking. Do we have time to really set aside to go to therapy? So those are the things that have prevented a lot of people from going to therapy. And I would say that it's opening up now because virtual, the ability to use insurance to go to therapy. And again, when we talk about reducing the stigma and changing the narrative around therapy, that's very helpful to let people know it's not taboo to have a therapist. It's actually kind of swanky now to say, I have a therapist,
Yeah, exactly. Yeah. And you and I were talking about this before, how the role of stigma and how it may have changed over the years, especially for the younger generation. Can you talk more about that? Like what stigma used to be, how it used to be, and now what are you seeing with stigma?
Yeah, I will tell you that I see so many young people now that really embrace the fact that they have a therapist, right? And they come in, they're ready to talk, they're ready to share. Listen, I'm not ashamed of my age. I'm a 58-year-old Black man. I grew up in Wyandanch, right? And so it was not something that you walk around proud of if you had to go to therapy. Again, if you had a therapist, most likely you had gotten in trouble with the law, or you were sent there because something tragic happened in the home or something like that. This new generation, they're not necessarily waiting until their life is totally in upheaval, right? They're starting to understand that it's okay to have a therapist, to go just to clear your mind. I have this anxiety around school. I have this feeling that I don't belong. I worked really hard in school. I've gotten good grades. And now I've got accepted to this really high-ranking school. But when I get there, I don't see a lot of people that look like me. So I have this imposter syndrome. They're coming into therapy to talk about it. Before, they would just have to power through, right? And whatever is provided there, many times, not therapists of color that are there to help them navigate that on that campus because it's a PWI, right? So you start seeing more people of color coming into therapy. And people, I will say this, there are programs that are very intentional about providing mental health services for their scholars and for the young people that come into their program. I work for an organization called the Fred Schauffeld Organization, and my very good friend, Sandra Mahoney, they're intentional about making sure that the scholars that come through their program have access, regular access to therapists on a regular basis, because they are sending their students to some of the highest schools in the country, and they know that they need that support.
Great. And you have a mantra that you use, which is reduce the stigma, change the narrative. So what do you think can be done to reduce the stigma and change the narrative?
This goes back to something I stated earlier about, so many of our problems are systemic. This is something I believe. The reason we designed the Brothers Like Us initiative the way we did is that we want it to be something that's consistent in the community. So we meet every 2 weeks, and I know we're going to talk about this more, right?
Yeah.
You have to place things in the system to combat the systemic disparities that we face. Now, I fully understand that we're fighting centuries of inequities and disparities, systemic inequities and disparities. So I may not see the full result of the effects of these type of programs, but I call them pervasive programs. You need programs that are part of the culture and the community. So when we talk about schooling, you need prevention programs that start prior to the young person even going to school, teaching the parents about how to attach to their children properly. And then when they're released into the school system, the school should have some prevention programming. It may not be overwhelming at first, but you start giving them the language and the tools to learn. So you're not just attacking it in high school once they got caught with the vape or they got caught with the knife, right? You're teaching these things very early. We have what we call a pervasive prevention program that we have designed for schools to put in place. It just becomes a part of the culture, part of the system, right? That's how you fight these systemic disparities.
Great. And then you kind of brought up your program, Brothers Like Us, Men's Wellness Initiative. So can you tell us more about that? I know you had a session last night, too.
Yes, we had a wonderful session last night. The design of the program, every 2 weeks, we meet. It's right here in the heart of Hempstead. We've partnered with the Hempstead Union Free School District and the Parent Resource Center, my very good friend Tracy Williams. The reason that we partner with them and why it works so well is that they have a very comfortable space, right? And I talked about earlier, I talked about creating programs where when someone comes in, they don't feel like they're going to social service. They don't feel like they're going to the DMV, these sterile environments. It needs to be something comfortable. So we have great music playing. We have food prepared and ready for them, and nice comfortable seats and chairs, and they could just come in and let their guard down, right? So that's every 2 weeks in the heart of Hempstead. It started in October. It's going really, really well. Wow. We were very intentional about the design, again, because we want to make it a part of the culture and a part of the community, the system of the community, because one thing that we know is that you can have great programming, but if it's only there for 1 year and then it disappears, what's the use, right? The other aspect of it is discussion-based. It's not lecture-based. So even though we have subject matter experts come in, we're very intentional about, yes, you come in, you share your story, you get people excited about how you got to where you are, but then there's time set aside for discussion, for other brothers to say, hey, that sounds like something I went through. This is what I went through. How did you navigate that? Well, this is how I navigated it. It opens up the dialogue so everyone feels heard. No one feels like they're sitting in the back of the room and like, I could never be that guy. No, you can. You are that guy. You are that brother, because you're all facing the same things every single day. And no matter how accomplished someone is, they're still facing daily challenges just like everyone else. And that's the beauty of the program.
And you mentioned the different types of people who are coming to. Can you talk more about that?
Absolutely. So we have been very intentional about the type of people that we bring in. So yes, we have judges that attend. We have attorneys. We have defense attorneys. We have probation officers, police officers. We have doctors, nurses. We have mental health specialists, like licensed therapists, all coming in and sharing their expertise. But also we have barbers. We have sanitation workers. Anybody and everybody. It doesn't matter where you are. We also have students, young people. Maybe they just graduated from high school. They don't know if college is for them, what they're going to do next, trade schools, whatever. Anyone's welcome. Anyone's welcome to walk in there to not only hear what someone else is saying, but also maybe you meet this judge and you connect with them, and that could turn into an internship for you later on. So if you're going into that field, you have a personal connection. The beautiful thing about it is it's people from the community. So you very well might bump into this judge, this attorney, in the supermarket next week. And now you have connection.
Yes.
It's not just somebody you're walking past. You're like, oh, hey, how you doing? We met, blah, blah, blah. You stay connected. That's the beauty of the Brothers Like Us Wellness Initiative.
And one other beautiful thing about it is that you said it's free, right?
Absolutely free. No one is charged anything. All you got to do, the only thing it costs you is time. Get there. You're going to be welcomed in. We just try to make it a warm environment, right? So you'll be welcomed, open to share whatever it is you need to share, whatever you want to talk about. And if you don't want to talk, you don't have to talk. Nobody's forced to talk. But what we found is once they're in that environment and they hear other brothers sharing, automatically they open up because they feel comfortable, right? And so it could be talking about your mental wellness, yes, but also about your health. Like, how often do you go to the doctor? When is the last time you went to the doctor?
Nice.
And this is what came up for me. And, I had to do this. My doctor suggested this. And so you can take that information back to your primary care doctor and say, listen, I heard somebody was going through this. This is what they did. What do you think about that, doc? It just opens you up to come out of isolation. That's the biggest thing for me is a lot of us suffer in isolation, in our own little silos. We don't want to necessarily talk and share stuff, and it's so easy for us to isolate ourselves. But when you see other brothers talking about the same things you're going through, it will encourage you to open up more.
Nice. And you had mentioned something about a private Facebook page.
Yes.
Yeah,
so on Facebook, it's called Brothers Like Us. If you search that and you're a brother, even though it's called Brothers Like Us, I want to make it very clear. It's not just for Black and brown men. It's for all men.
Nice.
Any brother can join the Facebook group. It's private, so we share different, of course, encouraging messages and stuff, but we also are going to roll out maybe a monthly group meeting where we'll all jump on a Zoom and talk about anything, just like we do live in person, but we'll do that. So brothers having another outlet. Again, make it a part of the culture, part of the community, something that people know they have a place to go, right, on a regular basis.
Nice. So if people wanted to find out more about Brothers Like Us or about any of your services, how can they get in contact with you?
Two ways. LongIslandTeamWorks.org has a lot of our information. A lot of our stuff is social media. So Facebook, Instagram, Threads, of course. We haven't done TikTok yet. We're going to be rolling that out because, of course, that's something that needs to be done. So if they go on any social media, go to Long Island Teamworks, go to Thurston Daniel O'Neill or Thurston O'Neill. All of my pages, I share everything there. And the Brothers Like Us group page on Facebook. Yeah.
And before I let you go, I wanted to ask you, what can people do on a daily basis to be mindful of their mental health? Any tips that you like to share with people before we wrap up?
It's important for people to look at what does your social network and your support network look like. It's important to identify people that you can reach out to, that you feel comfortable with, that you're secure, that you can share stuff with. Like I said, a lot of brothers, a lot of men don't necessarily openly share like that. But it's important to have people like that in your life. On a daily basis, I'm big on affirmations, like telling yourself what you think about yourself, not necessarily what society thinks about you, but what type of person are you, right? And if there are things that bother you about yourself, what can you do to change them? Who can you connect with? That's, again, going back to the beauty of connection with positive-minded people is connecting with somebody that can guide you to the place where you want to be. And maybe this is a place where you're struggling right now. Affirmations on a daily basis and really like looking inwardly to who you are and who you want to be. Maybe you're not there quite yet. There is a way to get wherever you want to be.
Nice. So thank you so much, Thurston,
You're
for
very
joining
welcome.
us on the Healthline today. It's been such a pleasure learning more about
Thank
the
you.
work that you're doing and how impactful it is in the communities.
You can find all of our information at Facebook, Instagram, Long Island Teamworks. It may be spelled L-I Teamworks and not Long Island spelled out. Or my personal page, Thurston O'Neill on Facebook, Instagram, and you can get all the information that you need there.
Perfect. Thank you so much, Thurston.
Thank you, Andrea.
And thank you, everyone, for listening to today's episode of The Healthline. We look forward to seeing you next time. Bye-bye.